Ladies and gentlemen, and dear colleagues, thanks a lot for the invitation. And also on behalf of my colleague, Dr. Hartmut Gruger, we want to say hello. We are very happy presenting a collaboration between a dental sleep lab and a dental practice that has been growing within the last 10 years. And we just want to show how effective this can be and can be good for our patients. Jetzt bist du dran? Ah, nee. Just to present us, my name is Alexa von Gienanth. I'm a dentist in Düsseldorf. I have 3 certifications. This is dental sleep medicine and periodontology and implantology. And my colleague, Dr. Hartmut Gruger. Sagst du selbst was zu dir?
Yes, hello, thank you. No power?
Here, power.
Okay, we will change. Thank you for the invitation to Berlin. Yes, I'm physician for internal medicine and pneumology and, of course, sleep medicine and the head of the Hospital of Sleep Medicine in Düsseldorf. We are working with 21 polysomnography systems, 7 days a week, and around about 20 polygraphy systems each day for home measurements and monitoring for sleep apnea. So we are working in the whole field, big field of the sleep medicine, but our specializations are sleep apneas in all kinds, central obstructive one. And since more than 10 years, 12 years, we have a very close cooperation for MRDs. And so we will give you some insight in our work. There are some conflicts of interest, but not really big. We got some sponsoring for scientific work and lectures, but today you can ask what you want and you will get the truth. Yes, why MRDs? Yes, since 2011 you know that the MRDs are the first level therapy for mild and moderate obstructive sleep apnea, and also for severe apnea if CPAP devices is not tolerated. So in Germany we have the problem that only the private insurances give us the money or give the patients a reimbursement for the MRDs, and that's the reason why 80% of the sleep apnea patients here in Germany, the regular insured patients, has to sleep with a mask, or they had to go to the doctor for ear, nose and throat and make an operation. But the MRDs in the private sector are better tolerated, more accepted by the patients. And MRDs are more attractive than CPAP, in our opinion. You have more freedom. There is no tube, no noise, nor problems with air leakage, dry nose, stocked nose, dry mouth. You can travel easier. The whole handling from an MRD is much more easier than from a CPAP device. And so we will tell you a little bit about the circle of our cooperation. Alexa.
Thanks a lot. We tried, ich glaube, hier ist noch nicht. Doch? Yeah, okay. We try to give you an overview about how we collaborate. You see the blue part of the cake. This is, these are the fields that are done by the physicians, by the sleep medicine colleagues. And the pink part of the cake is what the dentists are doing. The patient can meet this circle, this workflow, where you see the star. This is at field number 1 and at field number 4. And in the following minutes, we are going to introduce the several pieces of the cake.
Yes, first appointment. Normally here in Germany, the patient is going to a general practitioner. He will make an examination, looked into the throat. Sometimes, if it's so extremely closed, big tonsils, then we will send the patient to the operation for the ENT. But if he has typical symptoms for obstructive sleep apnea, the patient history shows us snoring, daytime sleepiness, we ask for comorbidation or for medications and other diseases, and then normally we will decide to make a polygraphy. And in Germany, standard are 6 channels to see the effort signals for the differentiation between obstructive and essential sleep apnea. And after this measurement, it is possible to send the patient to a sleep lab, but alternative, we have the possibility to make a screening with less than 6 channels. For example, the dentist, Alexa, also has this kind of apnea system for their outpatients. And if a patient is by Alexa and he say, I'm snoring and I have daytime sleepiness, and she's looking into his throat and see, okay, the tissue are collapsing, then she will give him a sleep apnea monitoring system and also will send the patient to us to the sleep lab. So next step is sleep examination. If there is no clear result in the monitoring, if we see there is an AHI from 20, typical history, then we can start direct with the therapy. But if it's not so clear, mild sleep apnea syndrome, then we make a polysomnography. We want to see hyperventilations, look for central apneas or other disorders of sleeping. Yes, and the third step would be to decide which kind of treatment is the right one, and we very often prescribe MRDs. And then we make a letter, medical letter, and explain for the insurance why it's necessary. Yes, for example, we see it's retrognathie, we see no possibility for operation, and after the prescription from the sleep medicine part, then we send the patient back to the dentist, or first time to you.
Danke. Wir tauschen mal, weil das ist ein bisschen... Machst du weiter? Ah ja, okay. So, when the patient enters our practice, we have to check whether it is possible to do a mandibular device. So we check his dental status, we check the muscles, we check the joints. And in Germany, patients want to have a cost estimation because they want to talk to their insurances first to be on the safe side how much they might have to pay. Nächstes. Danke sehr. Then on the second appointment, we do the intraoral scan. We also scan the bite registration, and we will show this to you right now. Just an everyday situation from our practice. When the patient is coming at first, we are talking about the sleep situation. We are presenting MRDs, we are scanning, and we are very happy with the TRIOS scanner because the quality of the MRDs has got much better, and it is really fun. It is fun for our assistants doing it, and patients prefer it very much to impressions. Then about 2 weeks later, we can fix the MRD. We inform the patient how to handle it, how to clean it, and we do a muscle training with him because it is important that the muscle situation stays stable and that we have less side effects. So the third appointment is when the MRD is given to the patient, and well, to say something, why fitting a Narval MRD? You have to ask first, Are there differences between the MRDs you can achieve? Of course, there are differences. There are two big groups. There are thermoplastic MRDs and custom-made MRDs. And as you saw on my scan, I'm also presenting the Somnodent MRD, and I really appreciate it too. It's a very reliable, very good quality MRD. But in my practice, the Naval MRD really is the MRD that people want the most, because it is so small and it is light, it is very discreet, and I had to make my choice myself when it was clear that I had to wear an MRD too. On the fourth appointment, about 2 weeks later, we are asking the patient, how do you get on with the MRD? What changed in your life, especially in your sleeping life? But what is your sleeping quality? Are you still snoring, if there was snoring? How do you feel? Do you have more energy when you wake up? Do you have a better energy level than you had before? And when patients came from the sleep lab, we always sent them back to the sleep lab so that the position of the lower jaw can be titrated. And since we have been working together for so many years, the team of Dr. Gruger has been trained by me, and they do not hesitate waking up our patients and saying, Frau Müller, please, could I titrate? The AHI doesn't have the perfect value it could have, and then they do it, and Frau Müller turns to the other side and leaves the sleeping laboratory in the next morning with a perfect position. And this is a situation I always have to say thank you again, even when I was in the United States, and I did not meet any American colleagues who had a sleeping lab who was so cooperative. Thank you.
Yes, the most important thing for us in the sleep lab is looking for arousals. We will look if the MRD is from the protrusion grade optimal, or if we see some arousals of respiratory induced arousals, then we will activate in the night with our staff the MRD. And that's important to get the patients back for us. You heard that only the private insurances are covering the costs in Germany. So for a lot of sleep labs, it's a problem if the patients have not a mask, if they have an MRD. Normally they say, my wife says I'm not snoring, I have no daytime sleepiness, so why to control my sleep apnea? And normally with the MRD, they're not motivated to go back to the sleep lab. And because our staff is working in the night and make some changes, there is for the patients the idea, okay, that's good for me, I will do it. And in the time before we checked and activated the MRDs, we lost patients if we went from the masks to the MRDs, and actually we prescribe more MRDs than masks. Yes, and if you are interested to come to us to get more insight in our work, you're invited to come to Düsseldorf, look inside our hospital for sleep medicine, stay 1-2 days, so long as you want, to talk to us. And I think the same possibility is in your practice.
This is the practice, and this is where the patients are invited to our lectures. And of course, then we have more than 4 chairs. It's a very nice old building from 1873. And Hartmut is quite close to me. I can see him when I'm working in my practice. I can see your building.
Yes, only 300 meters for the patients. They can go by feet from our unit to Alexa's unit.
If they could fly, it would be 70 meters.
Okay, feel free to ask questions.